Hi, Sarah.
Hi, Dr. Handa.
Thanks for doing this.
Oh, my pleasure.
Yeah. So tell us about your journey that led you to us.
Yeah, it's a crazy journey. It took many, many years, a lot of struggle, a lot of strife. I had a number of TMJ symptoms that I had no idea were all interconnected. I had chronic pain in my back and my shoulders, my neck, my jaw. I couldn't sleep well. I couldn't chew well. I couldn't speak well. I couldn't breathe well, having no idea that these were all part of the same problem. I went through many different dentists who all told me I had problems with my bite, grinding of my teeth, I was losing gum, they said my teeth were gonna fall out. No young girl wants to hear that her teeth are gonna fall out. Many different dentists. I went through actually literally a dozen dentists,
Wow.
half of who told me there's just no cure for my problems. I'm just gonna have to live with this and accept that my teeth are gonna fall out. The other half told me there is a cure, and the cure is jaw surgery. And I felt like, as like a young woman, that was a really big step. It was very invasive, and I was really hoping to find some other way to heal myself. And it wasn't until I met you, Dr. Handa, that I found that person who believed in my body's ability to heal and could provide a science-based solution for how I could get there.
Well, you're very special, and I think you made so many links yourself right when we first met. And you were able to look at whole body health and science and really apply it to yourself. So thank you.
Thank you.
And I guess that was my next question, is what made you feel this was it? Like, what made you say, because you and I had never really met. I know that you got referred to me by another doctor, but you had immense trust from the beginning.
Right.
Yeah.
That's a great point. I think there's probably a lot of different things, but if I had to say what was most salient, it's that, yes, I was referred to you by a doctor that I trusted, and the moment we met, it just clicked. It just felt like we were on the same page. We understood where we wanted to get to together, and we knew that we could be a partnership. I had not felt that way with any other dentist beforehand. It always felt like I was being patronized or talked down to or belittled or just put in a box. And I never felt that way with you. I never felt that way. I always felt supported and trusted and lifted up.
Thank you for saying that, because one of my goals really is to have my patient on my team. I know it sounds crazy, but I feel like if the patient's not part of my healing team for that patient, it almost never works to the optimal level. So you've been a great team member.
Thank you. Thank you. I'm really happy to be on your team.
Could you elaborate on what you saw change in phase 1 when you wore the C2O appliance?
Oh my gosh, it was actually night and day. I remember getting the device and I was driving home and I started tearing up because I had never felt the alleviation of my pain like so rapidly. I'd had this pain for 15 years now. I thought I was gonna have to live the rest of my life with it. And I put it in and I'm just driving home and suddenly it's like rainbows and like sunshine and like the clouds parted and like this is life. Like life can be pain-free. Like I don't need to, I had such tension that I couldn't even turn my neck, and I just had gotten used to that. And
I think that's a great point to bring up, because sometimes we don't know what it is to be pain-free, and you hit that moment like you so beautifully described, and you see that it can be different.
Yeah.
It can be different.
Totally.
Any challenges with phase 1?
Oh, any challenges? I wouldn't call it a challenge, but I would call it an adjustment period, because you go from, you think like, oh, I'm done with appliances in my mouth, and you're just so used to looking the way you look, and then you get used to, oh, I have to wear like a device inside, and oh, like people think that I might talk differently, or oh, I'm gonna have to get used to talking this way. But after that very short adjustment period, I feel like it's just, it's just like a thing that you do,
Something that you do. That's great.
Yeah.
How's the DNA in your phase 2 going for you, the DNA appliance?
Yes. This is where I feel like it's like the real thing is happening. It's like you get to see the results. Like every day you can like see pictures from when you're a child or pictures even from just a few months ago and think like, wow, I look so different. Like my smile looks better, like my face looks more symmetrical. People tell me I look more radiant
That's
and
true.
happy, and
Yeah.
and I feel like it doesn't hurt to smile anymore. It used to hurt to smile, and
Wow.
it's like I can just be happy and I don't need to feel pain about that,
That's
Yeah.
amazing. So in addition to the DNA, you've been also an amazing student of the myofunctional therapy.
Thank you.
So how has that been for you to incorporate it in your daily lifestyle?
Yes. So interestingly enough, this was actually like my phase one. It was like my pre-phase one because we got to start during the beginning of COVID when we were just speaking on the phone and on
True.
Zoom, and you were teaching me the Myo exercises before I ever even came to the office, before I got my C2O and my Vivos DNA. And even that was like a total game changer. I thought, wow, like I had no idea that this like part of my body, I could like work it out. It's like a strength training workout. It's like I get to like, it's like my tongue's pumping iron. It's kind of fun,
Right.
Yeah.
Yeah, I think it's cool that you say it like that because we don't realize how strong and powerful our tongue is.
Yes.
In all of this chewing and grinding and swallowing and of course talking, but it's a really strong muscle that influences a lot in the structure up there.
It really is. And especially for me coming in, one of my favorite things to do was sing. I was like a singer. And so for me, I hadn't realized like, wow, there is so much more I could do to improve my singing.
And so you feel a shift in your singing?
Absolutely. And in my speech and in my breathing, in my like chewing and my swallowing and everything. Yeah.
You're like a picture postcard. I want to be you.
Thank you.
What's synchronized with our office style for you?
That is such a great question because it really ties it all together. I've always felt so much support coming here. I've always felt like I was put first, like my needs and my desires were prioritized, that I wasn't a burden, like that had never happened before, As a patient, you often feel, oh no, like they're having to spend so much time, or they're too busy for me, or like I'm getting in the way. I've never felt like that here. The office environment, the people who work here, the camaraderie, the teammanship, it's just, everything is beautiful. Everything is stunning and tranquil, and just it's the way life should be. You come here and this is the way life should be. Like when you come to the doctor, you should be coming to somebody who actually treats you with respect, but we're not used to that anymore,
No, we're not used to. I think that somewhere in the way of life we forgot. Because life got busy. But I really love how the old black bag way of the doctor can meet the new scientific way, along with discovering the deeper meaning of life.
Yes, exactly, because it's all interconnected.
It is all interconnected, and I try and remember that even when I'm at a restaurant and they're being rushed or not being attentive, that it could be also different if you just stopped and breathed. So thank you for really acknowledging that.
Oh, my pleasure. Thank you.
I want to end with saying something about you.
Oh, okay.
That you were one of my early on patients in COVID. Right, like when the lockdown was ending, it was like the last couple of weeks, and we started talking on the phone. We did some of the tongue work, tongue exercises on the phone. But your focus, your curiosity, your commitment to whole body health was so inspiring in those early days of post-lockdown when I didn't really know what I was coming back to in terms of my practice or dentistry, fear. But having met you were one of my early on patients that inspired me to come back to work, even when I was a little scared to come back. So you made my entry into post-lockdown really, really amazing. So thank you for that.
Thank you, Dr. Handa. Thank you so much. It's so heartwarming.